Purposes of the 5-month ultrasound. Number 1, anatomy check. Brain and skull, to ensure the brain is developing properly and the skull bones are forming correctly. Spine, to check for normal alignment and development, ruling out conditions like spina bifida. Heart, to examine the heart structure and function, checking for congenital heart defects. Kidneys and bladder, to ensure these organs are present and functioning properly, with a check on the bladder filling and emptying during the scan. Stomach and abdominal organs, to verify the presence and development of abdominal organs, ensuring no abnormalities. Limbs, to confirm that all limbs are developing correctly, with appropriate measurements of bones. 2 growth measurements. Head circumference, to assess brain and skull growth. Abdominal circumference, to monitor the baby's growth and overall development. Femur length, to gauge the growth of long bones and overall limb development. Estimated fetal weight, to estimate the baby's weight and ensure it falls within a normal range for gestational age. Number 3, placental position and health. Placental placement, to check for conditions like placenta previa where the placenta covers the cervix, which may affect delivery plans. Placental health, to assess the blood flow and functioning of the placenta, ensuring it is providing adequate nutrients to the baby. Number 4, amniotic fluid levels. Fluid measurement, to ensure there is a normal amount of amniotic fluid, which is crucial for the baby's movement and lung development. Fluid anomalies, to identify conditions like polyhydramnios or oligohydramnios, which might require further monitoring or intervention. Number 5, umbilical cord. Cord insertion, to check where the umbilical cord attaches to the placenta and ensure it's functioning properly. Cord vessels, to count the number of vessels, typically 2 arteries and 1 vein, and ensure proper blood flow. Number 6, gender identification. Sex determination, to identify the baby's gender if parents wish to know. This is typically possible at this stage, though it may depend on the baby's position during the scan. Number 7, detecting structural anomalies. Cleft lip and palate, to check for facial anomalies such as cleft lip and palate. Skeletal dysplasias, to identify any abnormalities in the bones and joints. Other anomalies, to detect any other structural anomalies that may affect the baby's development. Number 8, overall fetal well-being. Movement and activity, to observe the baby's movements, activity level, and general well-being. Vital signs, to check the baby's heartbeat and other vital signs, ensuring they are within normal ranges. 9, assessment of multiple pregnancies, twin or multiple check, for parents expecting twins or multiples. The ultrasound helps in assessing the development and positioning of each baby. Complications management, identifying complications specific to multiple pregnancies, such as twin-to-twin transfusion syndrome. Number 10, detection of maternal health issues. Uterine health, evaluating the health of the uterus to identify issues like fibroids that could impact pregnancy. Cervical length, measuring cervical length to predict and manage the risk of preterm labor. Number 11, monitoring baby's movements. Activity levels, observing the baby's movements helps assess their activity levels. Behavioral patterns, identifying patterns of movement, which can be reassuring to parents. Thanks, don't forget to subscribe to my channel for more informative videos on pregnancy, prenatal care, and everything. Make sure to hit the notification bell so you never miss an update.